Started.
I don't like it where we ended up.
Good morning, everybody. Very happy to see you and see that the numbers are still rising. There's more and more people coming in, so I'm gonna
In there.
talk a little slower so that everybody can get on while I'm doing an introduction. So this is the 2023-2024 open enrollment meeting, and this year's meeting is a, let's say, very important one, because what most of you might not know at this point is we will change carriers. So we will be no longer with Anthem. We will be switching to Cigna. And of course, that's always a little disruptive. And I know that's not the best that everybody is gonna be looking for. But unfortunately, due to some big claims we had on the last benefit year, Anthem decided to really raise the premiums a lot, by 25%. So we were able to get a better deal at Cigna. And on top of that, and we are very grateful for that, senior management decided that most of the increase that Cigna was putting on us will be taken up by the company. So most of you will just see a very small increase in their premium. And by very small, I'm really talking less than $5. So it's really, really not a lot in your benefit premiums. And that since we are switching carriers, it's very important that all of you go into Connect and do the changes for this year, because there will be no Anthem anymore. You will have to re-enroll. Also, the vision insurance will be with Anthem. So that's like a lot of reasons that we need to make sure that all of you go into Connect to your benefit enrollments. If you have any questions, you can contact HR, you can contact Libby. Also on our intranet side, you will find all the information on the different plans. This meeting will be recorded and you will later on be able to actually review that if there's more information that you need or that you think that you haven't seen in the first time. And all the details that we need in order to, understand the new plans and to make a good decision will be presented now by Ross and all the carriers. And that's the moment where I stop talking, and I hope I talked long enough to have the numbers go up to almost 70. So Ross, I'm going to leave it to you now, and I will be here if there are any questions.
All right. Well, thank you very much, Iris, and also to Libby there. And here we go. So as Iris just mentioned, we are going to be making a few changes, so be sure to pay attention. So this, as you know, there we go, is your open enrollment. And one of the things that we're bringing back by popular demand, it's the virtual open enrollment. This is the one that has the tile squares. You'll get a link and you'll just click through all the different tile squares, and each tile square will give you great information on everything about your benefits. And for those who actively take place, you'll see there's a bunch of prizes that we're going to make available. And basically it's for the person who goes through the most tiles, you'll be eligible for any one of these different prizes. So we're trying to make it fun as well. Here's, whoops, not too far. Well, this is weird. Sorry, this is, well, I don't know why it's skipping. Hang on, we're having a technical problem. Oh. Okay, I don't know what's. Sorry, it seems to be skipping the slide. Well, we'll just do without that slide. Anyway, Here we are with the 2023 benefits package, and you'll see here we have a new carrier for the medical. Now, this is just for the Anthem. We're changing Anthem to Cigna. No change on the Kaiser, and no changes with MetLife and new carrier for the Vision. Hoping. Okay. These are benefits that are provided by your company at no cost to you, and that's the Life and AD&D, Employee Assistance Program, Long-Term Disability, and Short-Term Disability. Although the short-term disability, because we have this already in California, it excludes California and also Oregon and Massachusetts. We have voluntary benefits. These are employee paid, and you still have access to your Sun Life, voluntary life and AD&D, your flexible spending account, pet insurance, and legal shield. And we also have coming back again this year is Trustmark Accident Plan and the Universal Life with Long-Term Care. Let's see. This is as Libby had, or excuse me, as Iris had mentioned, this is a very important time of the year. This is your open enrollment period. You do need to make an active selection. So you do need to go on your intranet and go into your program and make sure you actively enroll in all your benefits or decline your benefits. So as the open enrollment period, this is your ability to add or remove dependents, select different benefits. So if you don't like Cigna and you want to go on Kaiser, you could do that as an example, or vice versa. If you want to go from Kaiser to Cigna, that is your time to do that. This is the time you can update your personal information, verify your life insurance beneficiaries, and you also want to log in to make sure you make all these selections. Again, if you don't do it, you'll be in a situation where you won't be able to do anything until the following year. So you do want to make sure that you actively enroll in all your benefits. There are certain situations throughout the year, what we call qualifying life events. So in other words, if for instance, you didn't enroll your spouse because you're not married, but you get married later on during the year, you do have the ability to add your new spouse. Same thing with like a birth or adoption, anything like that, you can make changes. These are just the items here telling you what those qualifying events are. Marriage, divorce, separation, a COBRA qualifying event, a judgment decree because you have to provide child support, or a change in residence affecting your eligibility or access. So those are some of the reasons why you might change, or why you might want to be able to make a change. Okay, so our first person up is going to be Kaiser Permanente, and I believe we have our rep from Kaiser, and here we go with, do I have that right? Kaiser. Do we have the person on from Kaiser? No. All right, so I guess I'll be going through the Kaiser. As you know, with Kaiser, it's easy to find your healthy place with connected care. With Kaiser Permanente, they combine doctors, hospital, all into one plan. So with Kaiser Permanente, it's kind of a one-stop shop for those that are familiar with Kaiser. I used to be a Kaiser member, and I remember how easy it is to navigate my health through Kaiser. You just need to make sure that you do everything through Kaiser. Kaiser provides preventive care to keep you healthy, specialty care when you need it, and support for ongoing conditions. And you can also get Kaiser Permanente in your language of choice. So if you are Spanish speaking or anything else, they do offer multilingual support for you. Let's see.
Yeah, thank you.
So Kaiser also provides mental health services care for support. So don't be, make sure that if you have any issues with regards to mental health, whether it's depression or family issues or children issues or anything like that, Kaiser has a wonderful facility to provide you with all those services. Okay, there are many convenient ways to get the care that you need. You can talk with a Kaiser physician by video or phone with the same high quality care as an in-person visit. The easiest way to do that is just to make sure you have a Kaiser account, log into Kaiser, and there's a place where you can just click on make a video call or a phone call with your provider. You can also email your doctor's office with non-urgent questions. So Kaiser does make it very easy to access Kaiser for all your needs. Didn't say on here, but you can also do all your prescriptions. You can refill all your prescriptions by going online. If you're traveling, now this is something new with Kaiser Permanente. When you're traveling, you'll be able to access a Minute Clinic through either CVS and Target stores throughout the United States. So whether you're here, obviously, if you're here locally, you can access your care locally. But if you are out of state, you can actually access care by going to a CVS Minute Clinic or a Minute Clinic in a Target store. All you have to do is just call the 800 number, or here it is right here, the travel line that's been given to you, or you can click on kp.org.travel or /travel, and you can get care throughout the United States when you're not here in your local service area. Okay. These are additional support that helps you to thrive with Kaiser. Here's a ClassPass. It's reduced rates at fitness classes, self-care apps for Calm and My Strength, wellness coaching by phone, reduced rates on specialty care services such as acupuncture, chiropractic care, and massage therapy, on-site education classes and support groups, and online healthy support programs. These are all available to you. Here, just a quick outline of your traditional HMO benefits. No deductible. Maximum yearly out-of-pocket is $1,500 for individuals, $3,000 for family. Preventive care, always no charge. Office visits, $30 per visit. Lab and X-ray and radiology, no charge. Outpatient surgery, $30 per procedure. Hospitalization, $250 per admission. And emergency care at $100. And that takes us all the way through Kaiser Permanente. So if you have any questions, I'll just remind people, you can type in chat and you can list your questions in the chat feature, and then we'll make sure that we come back and answer any of those questions. So with that, this is going to take up a little bit more time in that we're going to be going now into your new Cigna plan benefits that will be taking effect on your anniversary of October 1st. So do we have our Cigna rep?
Yeah. Yes. Can you hear me? Good.
Yeah. Okay.
Awesome. Great.
So just tell me when to click the slides, and I'll go through each of the slides for you. So
Thank you.
is this Sonia?
Yeah, Sonia Van Hetty.
All
Hi,
right,
everyone. Thank you for joining us today. I know I'm going to give you guys a ton of information, but I just want to assure you that if you come back to this presentation one more time and do a couple reviews, you're going to get everything that we have. Also, don't forget, you can always navigate to our website. So with that, I'm going to go through all your benefits, kind of explain them briefly. We'll go through some housekeeping while we go through the benefits, because I know for some of you, you're thinking, okay, I get it. We're changing carriers. What does this mean to me? And I want to assure you that the majority of you are just simply going to go in. If you're on this HMO plan, you'll go into Cigna.com, and I'm going to put that inside of the inside of your chat. So if you want to go straight to the link to go look up your providers, you can go there. But it's Cigna.com, and you'll be able to look up your provider and see if he or she is with us. If they are, great. All you have to do basically is get that PCP ID number and put it into your enrollment system. So we assign you to that same provider. Keep in mind, you want to make sure you pick him through the right medical group, because we all know that some doctors might work with multiple medical groups. So I want to make sure you do that. This plan only had a few changes, and let me highlight those for you. Virtual office visits are $20 copay. I'm going to go into more detail of what virtual care is, but I think for most of us that have been at home, maybe in the past couple of years, right, we kind of learned what virtual care was because we were doing it. So if you haven't done it before, I highly encourage you to go into the mycigna.com once you're in our system and register with the virtual care, because you'll be able to see exactly what you have at your fingertips from the comfort of anywhere, whether it be your car or work or home. You'll be able to do virtual care. So that's one area that changed. It'll be a $20 copay. Another area that changed was urgent care. Urgent care is $25 office visit copay. So if you need to see a doctor, right, there's several ways that you can see a doctor. One, obviously, you can always call your PCP. I know for myself, I've established a relationship with my doctor. I go every year and I get my annual. You guys know how much that costs? Absolutely nothing. If you do your physical, it's 100% covered. And I'll tell you, I've gotten things like the C word that almost got me, but it couldn't, because I was always on top of my health, making sure that every year I go in and I do those preventative exams to catch things in early stages. So if that's you, great. You pay absolutely nothing. So anything other than that, you know, it's a copay based plan, this plan right here. So it's pretty easy to navigate. If you're already seeing a doctor, right, maybe you're currently with a specialist and you have a standing referral, maybe to neurology, ortho, or gastrology. If you have a standing referral, I just ask you to call your primary care doctor, let them know October 1st, my insurance carrier is changing. It will be Cigna. Can you please update my referral to say Cigna? Because one of the things they do when you go into the office is they verify eligibility. And if they run it through Anthem, guess what? You're not in that system. On this plan, another thing I want to mention to you that's important, I really feel it's important, is what is your stop loss? When do I stop paying, Sonia? I see these copays up here. I'm at your plan. I haven't seen it lately. It's very rich, meaning that your copays are really low. Most employer groups have much higher copays than you do right here. But all these copays, once you reach $2,000, that is your tap out. That's it. That's the most that you would pay for one individual in your family or yourself, right? By yourself, that's it. Once the copays add up to $2,000, you are covered at 100% for that calendar year. That means from January to December. Even though your plan starts October 1st, we're talking January to December. So with that, then let's go into prescriptions. Prescriptions had another little change on tier 1 or mail order. So for you folks that are taking medications, I want you to go to the link. Now this presentation will be available for you. It has a drug list that you can go into and you can take a look and see, is my medication with Cigna? Because most carriers have a different drug list. We have pretty much the same things, but some things might be a little bit different. You might find something that you were taking before that they told you couldn't take no more, but it's with Cigna now. So you want to check the drug list to see, okay, where does my medication fall under? It doesn't fall under tier 1, tier 2, or tier 3. So you're clear on that. And if there's any type of authorizations that were done for that particular medication you're taking, just let your providers know. Obviously, Cigna is your new carrier, and they'll put in the paperwork that they have already submitted to make sure that continues on seamlessly. In most cases, it's going to be seamless, guys. Nothing's going to change. Now, you do have one thing, another thing added to your plan. I don't know if you ever had it before, but we have this with Cigna. It's called our Preventative Drug Advantage Plus list. You guys are going to be able to get the most out of your plan because those things will be available to you. And in some cases, you won't have to pay no deductible if your plan has it. On this plan, it doesn't have a deductible. Even though it mentions it over here to the right, disregard that. This plan only has an out-of-pocket max and copays. So once your copays reach out-of-pocket max, that's it. You tap out and you're set. Take advantage of mail order if you're on maintenance medications, because that will get you your medicine for a 90-day supply at a lesser cost, allowing you to save money. If you've never done it before, just pick up the phone and call us and we'll guide you through that. There is a pre-enrollment line that has been set up exclusively for you guys So if any questions that you have after we stop this call today, and maybe it's honey when you get home that you didn't ask that question you were supposed to, they can call in and we'll be able to answer any questions regarding the plan so you can make a wise choice for this coming year. Go ahead and go on to the next slide. This one is our traditional PPO plan. That's what you guys call it, PPO. At Cigna, because we're insurance carriers, we love acronyms. And our acronym for PPO is OAP, just the name of our directory. It's called Open Access Plus. At one time, we did have a PPO directory, but we went out, we negotiated with our doctors, we brought on more doctors, and what? We created a new directory. It's just called Open Access Plus. On this plan, it does have a deductible that has to be satisfied. Just remember that. So if you want the ability to go to any doctor you want without a referral, this might be the plan for you. Also, this plan has out of network. I think if you have your mic on, if you could just mute it, because we are recording this for you guys to get to this later. This plan here had only a change in virtual care copay. It's a $30 copay for your virtual care. Just remember, it's not covered out of network because we have an exclusive provider, MD Live. We want to make sure you stay with that provider when you're doing virtual care. And remember, you can do it from anywhere you want. Urgent care. Your urgent care on this plan is $50. And the only other thing that changed was, again, the mail order tier 1 prescription is $60 instead of what it was before, which I'm not sure what it was before. Oh, another key thing to remember on this plan, there is no out-of-network benefits for prescriptions. You have to go to the contracted pharmacies that we have. We have over like 70,000 pharmacies, so it's really hard to go outside of the network. But if you're using one that was not in the network, or you look it up, you can look it up, but more than likely it's going to be in the network. If it's not in the network, just know you have to stay in the network. There isn't a benefit out of network. And one thing I want to mention on PPO plans, because sometimes folks might have providers that are out of network. Just keep in mind, both areas in and out are two separate buckets. So if you're going to the in-network providers, this is accumulating, copays accumulate towards out-of-pocket maximum. Anything that has a percentage, you have to satisfy deductible, which is $750, right? And every individual in your family to a max of $2,250. After that, that applies to your maximum. Once those items reach $5,000 for an individual or $10,000 for a family, you tap out. The plan covers 100% in network. Now, if you go out of network, that's a separate bucket. You're going to start paying that deductible out of network and that co-insurance. So just keep that in mind when selecting providers that you call Cigna, or most providers that are in network, they do all the homework for you. That means they call Cigna, they verify the outpatient facility to make sure it's in network to do that surgery. If you're personally going to another lab or to an x-ray place, you want to make sure you go on your app or you go on my Cigna app. And you verify that it's one of our providers in the network. You get the richest benefit. Sometimes doctors will send you down the hallway to a lab, but you might not know that it's not in network. So just be cautious. This plan allows you the ability to go anywhere you want, but we want you to get the most of your plan. So you want to try to stay in the network so you can get the most. Go ahead and go on to the next slide. This is our high deductible health plan. This plan has a couple more slides, okay? You guys know it as, we call it high deductible health plan. We also call it Open Access Plus, HSA, deductible high health plan, OAP. It's still the same directory as the PPOs. If you're doctors on the PPO plan that we call OAP, he's gonna be on this plan. We use the exact same providers. Now, on this plan, the biggest difference between this and the traditional PPO is that this plan requires you to satisfy what's called the combined medical and pharmacy deductible before the plan covers anything, even an office visit. The only thing that is covered at 100% from the get-go will be your preventative exams, and certain preventative medications will be covered without a deductible having to be satisfied. So I want to make sure you know that. But if you're comfortable on this plan and you know, hey, I hardly use the doctor, but I want the ability to go anywhere I want, this is a great vehicle because it's comprised of two different things. And we'll talk about the second part that it's comprised of. This is the medical plan. And as you notice, one thing I want to highlight, because this isn't common, most plans have co-insurance once you meet deductible. If you notice on your plan, it says a $1,500 deductible. So once you meet that, you see where it says no charge after deductible. That means your coverage is at 100%. The only area where you would satisfy copays would be prescriptions, and it could take you up to $3,000. But other than that, once you meet $1,500, your services staying in network will be covered at 100%. If you go to the pharmacy, Those will continue at a copay scale. And if you notice here as well, you'll notice that the mail order prescriptions also changed to $45 on tier 1. That was the only change on this plan. There's kind of cool things that you can do to kind of contain costs. That means you can call us and we can help you. Most of our website has cost comparison tools. If you need to see a doctor, or you want to see how much a lab costs, you can do that all through our website and be able to navigate your plan and try to keep that money and that second component that we're going to talk about right now. Go ahead and go on to the next slide. So what is a HSA? An HSA plan is basically 2 components. One is the medical plan, right? I showed you the benefits and what you have. The second component is this wonderful thing called a health savings account. It's where you can take some of your hard-earned money, and instead of paying it in additional premiums to have the ability to have that plan with the self-referral, you can take your hard-earned money and put it away in what's called a health savings account, where you can accumulate dollars all the way through your lifetime, well, up to age 65. Once you start Medicare, you can't continue contributing, but once you contribute to this account, you can use those dollars for qualified expenses, or you can save them for future healthcare costs. That means that when you get to Medicare, you can actually use these to offset any costs that you may have in the future. Also, it still gives you the convenience of having those same providers that you have on a PPO. If you do preventative, it's covered at 100%. In this plan, both you and the employer get the opportunity to contribute into your HSA account, so which is rather nice, right? So there's an opportunity for them. And most of your contributions, when you put them in this account, you can do them different ways. First, you can go ahead and have it payroll deducted out of your paycheck, and it'll be pre-tax. Federal tax in California, another state, I think there's only 4 other states as well that only federal is the one that you save on. You still pay state taxes, but the other states, they don't pay no taxes on. You're contributing into this plan, tax-free dollars. As you use those dollars, guess what? You're going to use tax-free dollars to pay for those expenses, as long as it's a qualified expense. And if you leave it in there, you actually have the opportunity to do investment. So once you're above $1,000, you get to take whatever money you have, you know, you can leave some in cash allowance if you want, but you can always easily move it back. You can put it in investment options that are available to you, so your money makes you more money. So the key here is keep your money in the account as long as you can. If you need to use it, yes, you can use it. I know for myself, when I had this plan, what I would do is I would save my receipts and I'd reimburse myself once I had a significant amount, and then I'd take a little vacation or do something with it. I had the ability and I had extra discretional income to do that. For some folks, they need to use it as they go along. If the case is that maybe you have an expense early on and you don't have enough in that HSA account, I just want to assure you that as the money drops into the account, maybe you made a payment arrangement with the provider, you can take that money and you can pay that provider, or you can reimburse yourself if you paid with a credit card. So you always have access to your money to reimburse yourself back for any qualified expenses, or you can leave it in there and let it accumulate year after year. You never lose your money. You can use it for other options as well when you get into retirement. Go ahead and go on to the next slide. So not everybody qualifies to participate in this plan. And I want to make sure you know who gets to qualify and participate. First of all, everybody always wants an HSA account. I want an HSA, but unfortunately I have an HMO plan. If you have a high deductible health plan, you're allowed to open up an HSA account. Now, you might have your spouse's plan. If you have your spouse's plan, I just want you to keep in mind that it has to be another high deductible health plan. It cannot be an HMO plan. So you, the owner of the HSA account, cannot have dual coverage. Your spouse, that's a different story. You, as the owner of the HSA account, cannot have dual coverage. So I want to make sure you know that. Also, you can't be claimed on anybody else's tax return. Who does this apply to? It applies to my kids that are like 23, 24 and still on my health plan, because either they're in school, right, still studying, or maybe they just haven't landed that job that gives them those great benefits. If you have a child on your plan, that's great. But just keep in mind, if they're doing their own tax return and they're not your tax qualified dependent, they can actually go open up their own HSA account. You just call any of the banks to participate. You can even call HSA Bank and tell them, I have an adult child that does their own tax return. I want them to open up their own HSA account. And they can start putting away for their healthcare future. Hey, that's almost like cutting off the umbilical cord a little bit, right? We're getting them there to that level of maturity to be able to pay for their expenses. So that's what that means right there. if they're covered on somebody else's tax return. I'm not talking about your spouse if you're filing separately. That doesn't count. I'm talking only about a dependent that might be filing their own tax return. Now, for some of you, you might be already close to Medicare age. Now, I would tell you that if you want to continue contributing into your HSA account, call the Medicare office and ask them what your options are as far as having to start on Part A, which is the hospital benefit, and delaying it until you truly fully retire, because you have a plan that offers you the ability to put away money in an HSA account. You'll have to call them and you'll have to ask those rules. But in some cases, I think I've heard, and I don't know for sure, that you can delay it and not start it on until you're ready to completely access Medicare benefits. But that's something that you're going to have to call them and ask. If you're on TRICARE because of military, or your spouse has a full purpose FSA, you cannot have an HSA account. That's the problem. You have a plan, but to have the plan, you need that HSA account. So if you have any of these situations, just keep that in mind. So those are the folks that cannot participate. If you qualify, great. These don't apply to you. Go ahead and go on to the next one. And then every year, the IRS allows us a contribution. In most cases, it's increasing about $50 to $100. So if you're under the age of 55 and you want to put the max away, okay, and you're going to be on the plan for 12 months, you get the ability to set aside up to $3,650, and then $3,850. I think it's $3,850 for an individual, and it's up to $7,750 for a family. Oh, I get it. Your employer is contributing. That's why the difference in $3,650 to $3,850 is the contribution difference between what your employer gives you and what the IRS allows. So remember, it's a combined maximum of what the employer gives and what you put in, and that would be $3,850. But your allowance is $3,650. You can do $3,650 this year as long as you stay in the plan for 12 months, right, consecutively. So, and then you can do another $3,650 for next year as long as you stay in the plan, 12 months. If you're a family, you can do up to $7,300. Now, if you're over the age of 55, I learned this a few years back. You, the owner of the HSA account, can do an additional $1,000, but also your spouse. So if they're over 55, they can do an additional $1,000, but there's a catch. They have to open up their own HSA account, and it's simple to do. If you really wanted to go through that, no problem. Call HSA Bank, ask them that you want to open up a separate account for your spouse so they could put that additional $1,000 in the account. So that's up to you. There is a minor cost to these accounts, just so you know. Your company absorbs the cost for your account, but if you open it up for anybody else, you might have a small little charge for that. And then that is it for this account. I'll have to go ahead and go on to the next slide.
Okay, just wanted to mention, LifeCare does not contribute to the HSA account. These are solely up to the employees.
Oh, is there incentives? That's what's counting towards it, or?
I think that might be the difference between this
okay,
year
I'm
and
sorry.
next year. So,
Okay, so there's incentives in there. So if the incentives are earned, then you're gonna have that difference and it's gonna be deposited in that account, just so you guys know. Okay, pharmacy. Just know, go ahead and go on to the next slide. When I got that big C word right, I was really scared, and I didn't know what was gonna happen. I was too young to hear it, and doctors prescribe things. They do, they try to fix what's wrong. And I just want you guys to know that if a doctor prescribes you something and you're taking it and it's causing you pain and you're not sure what to do, and you go back to him and he prescribes a different one and it's still causing you pain, and you know, this whole thing that happens if you've ever gotten sick like me, we have tools at Cigna to help you. I Googled, which worked for the carrier. I've been for the carrier for 20 years. I'm over here Googling things, knowing that most of those results are skewed. They're not always what they are. So if you want honest, clinically based information about what you're taking or what your options are, call Cigna. If you want to know how much it costs, go to Cigna's website. I mean, from pharmacy to pharmacy, you're not going to find much of a change in cost, but from brand name to generic, significant. And then from mail order, from retail to mail order, significant. So these are the kind of tools that are going to help you navigate this thing called health, right? As I've gotten older, I guess I've gotten wiser, right? Because things start happening that I didn't anticipate. But we're there to help you guys. There's discount programs that are available for you guys. So if your medication is costing too much, please don't fear. Call us. We're going to help you. We're going to help you with all of it. And Accredo is our specialty pharmacy. So if you're on one of those medications like for hepatitis C, which went about 50,000. Rheumatoid arthritis, about 6,000 for injectables. They're expensive medications, and we understand, especially if you're on that high deductible health plan, one medication can make you hit the $1,500 maximum, right? Just note that we have a credo, and they're going to help you. The specialty nurses trained in those particular medications, and if it's a complex situation, right, with multiple conditions, they're going to be able to help you navigate that. So always call us. Don't ever just reach out to the internet because you might not get the right. Go ahead. I do the vision, right? Yeah, go ahead and go on to the next one. So vision's important. As you can see, I wear these bad boys right here. I had like 15 vision. I had the best like vision. I could see you from far, but not no more. You look pretty nice now up close too. I got the whole soft lens going on. I tell my husband, I think it's because when we get older, we don't want to see each other's wrinkles anymore. So we get the soft lens. But on this plan, I just want to mention that you get an eye exam at no cost to you. And I'm talking a thorough eye exam. I'm talking about the blood pressure in your eyes, the retina, the doctor told me my retina's going to detach when I didn't know anything about it. He didn't say anything. I'm just like, what do you mean? So yeah, certain things we need to call Cigna and find out what can I do to not have my retina detached. Maybe I can do something about it, right? But you're going to get a thorough eye exam. That's what I'm getting at here. I know when they did my eye exam, they see something on the back of my eye. And he goes, I'm glad we got a baseline and we can see it and track it every year to make sure it doesn't grow and it doesn't get worse. But you'll get this. You'll also get lenses or contacts. You pick which one you want, but you get them every year. Your frames are allowed every 2 years, and it gives you an allowance up to $130, which is pretty rich. And if you get anything extra, it's 20%. Now, I'm going to be honest with you guys. I've been going to this boutique retail eye lens place for years. And I'm finally at the point where, you know what? I don't want to pay $500 for a pair of glasses. I know I want the blue lens thing, and I do want progressives and I want transitionals, but that stuff is expensive. So if you're having a challenge like I am with paying $500 for lenses, call Cigna and just ask, because I know they gave me a reference of a few locations that I can go to that are a little better priced than what I was paying, and I'm still getting quality service. So if that's you, like me, then just give us a call. But just know, if you go to somebody else and it's out of network, you can print the claim at Cigna's website and then you'll just submit it in. Keep in mind that your eye benefit, and I'll have to verify this, but I think it's on a rolling 12, meaning that from the time you get them, it's another 12 months. 12 months from there, or it might be every year. So if right now you have lenses from your current, I'm not sure if did you guys already have Cigna for vision, Ross?
No, they had Anthem Blue Cross.
Perfect. So that means, guess what? Go get your glasses real quick with Anthem and come over here and get them with us. Okay. And then I'm going to find out to make sure that it's, yeah, it is every 12 months. So it is a rolling 12 months. So go get your glasses with Anthem and then you can come get some with us, and just know it's every 12 months or every 24 months for the frames and for the exam and the lenses. Now I want you to get the most out of your plan, okay? I'm going to teach you about some support tools that we have. mycigna.com is your website to register once you're with us. We don't have you in our system yet because you're just enrolling. You have open enrollment. Once you submit everything, probably before your effective date of October 1st, you'll be able to, what's it based on calendar year? Okay, yeah. Okay, perfect. Thank you. You'll be able to register with myCigna, and you'll be able to do all these things right here, from printing your digital cards. I carry everybody's card on my phone now. I don't have to carry them. I just show them my phone and they can print it. I can fax it. I can email it from right my phone for everybody, even my honey. So you can do the price comparison tools. You can see it, the cost of things. So if you're on that high deductible health plan, you can do that. You can put trackers on there. You can do alerts for yourself to remind you of your physical every year. Some doctors allow you to make appointments online, believe it or not. And then other things like contacting your provider too. You can do it through here. It's not every provider, but it is some of them. Also, remember, if you're on that HMO plan, get in touch with the medical group you belong to, because they have a lot of good tools as well that you can use to help access your providers digitally if you needed to. Go ahead and go on to the next slide. So one guide is your concierge. You know how you go stay at a hotel and sometimes if you want to go where the locals go eat, you go ask the concierge and he kind of tells you where to go. Well, we have a concierge at Cigna too that helps you navigate, whether it be understanding your plan, knowing where to get care for that MRI, because we all know if we go to the outpatient facility for the hospital, it's probably going to be 10 times more costly than if we just went to a standalone outpatient facility for radiology. So we help you with that. We help you navigate that. When you call us, if we find that there's an opportunity for savings, let's say you're taking your medication, but you're calling in for that MRI, the guide might tell you, because they have a 360-degree view of your health. They might tell you, hi, Sonia, you know what? I noticed that you're getting this medication and it's brand name. Did you know that we have this counterpart and that's generic? And they'll mention it to you. If you want it, great. If you don't worry about it. But just know that we're going to look for ways for you to save money. Go ahead and go on to the next slide. And then this is just a snapshot of everything that we have available to you. When you navigate through the system, there's a lot of different ways to look for stuff. You can go to the wellness tab and you can say, hey, I'm stressed out. What do you have? And it's going to tell you everything that we have for stress. Or I'm trying to lose weight. What do you have for weight loss? It'll tell you almost anything in every situation that you may have. We even tap to WebMD if you need to get additional information. We do have a 24/7 line for nurses. If you need to talk to somebody, you can call us anytime. But we also have customer service. So if you guys all work different shifts, no problem. Call us anytime. We're going to help you. Remember, you got that personal guide. Then MD Live, we want to make sure you know it's not just urgent care like it was at the beginning. It's also primary care. So if you live in an area or maybe you've never done a physical and you want to do one virtually, you can actually do one. They'll give you the labs. They'll tell you where to go. So you go to their contracted labs, but you'll be able to do your lab. Maybe going to the doctor to follow up with your diabetes is really hard. You can do that specialty referrals too here. So if you wanted to manage that, you can. Also, behavioral health care is available to you from the comfort of your home, and dermatology. So you know that thing that's been growing, you can actually take a picture of it, send it in, they can diagnose it within 24 hours and give you a treatment plan, or at least tell you what it is. So all these available to you at the click of a mouse or picking up that phone. So with that, I think that one might be my last one. Yep. Go ahead. So if you need me, I'm going to be here. I'm going to put some links in the chat. Oh, no, we got Omada. Omada is a diabetes prevention and heart disease prevention tool that we use. It's not only a tool, but it comes with health coaches, a digital scale, support group, and interactive online training lessons. So if you know that you have a challenge in this area, and maybe there's a family history, you'll fill out a questionnaire, and then they'll let you know if you qualify for this program. But this is a great way to empower yourself to do something about things that could potentially be at risk for. So if you're looking for a way that's free, remember, free, you don't pay nothing for this, do that. And then just remember, we're 24/7, 365 days a year, whether it be by the phone, online, just go see us, and to look up providers, it's right here on the right. Go to Cigna.com, find a doctor. Your directories, remember, Southern California is not named Southern California HMO. If you're going to do PPO, it's called OAP, and that's the same directory for the HSA plan as well. And for vision, you'll see it there. Just put vision providers, and a separate directory will populate for that. Thank you. And behavioral health is in there as well. So any of those, also chiropractic and acupuncture are benefits that you guys have, just so you know. Thank you guys. And I'll be here. If you have questions, drop them in the chat and I'll start answering them right now. Thank you.
All right. Thank you very much. So next up is going to be your group voluntary insurance benefits for your MetLife dental PPO and HMO. And Carol, are you online?
Yes, I am. Good morning, everybody. Thank you very much, LifeCare, for letting us be a part of your benefit program. We are offering the dental insurance through MetLife for you and your family. And just to let you all know, as everybody knows, having dental is extremely important, just as important as your health insurance, because a healthy mouth gives you a healthy body. So always keep that in mind. With our dental insurance through MetLife, you can choose through a large network. You'll pay 30 to 45% less than the average. And all of your claims will be held and done through your dentist. So it should be very easy to just go to your dentist, get the work done, and they will file the claims for you. The other good aspect that we have is pre-treatment. We have a pre-treatment estimate that will always let you know how much you're going to pay at all times. And of course, our 24-hour customer care service in case you need it. Go ahead, next slide, please. So this is going to give you one of our 2 dental programs that we offer. This is a PDP Plus program. With PD Plus, you can choose any dentist anywhere. And as you will see from this chart, and I won't go through all of it because you will have a copy of it on your own through the materials we sent over. But you will notice that through in-network and out-of-network are the same percentage fees. So all of your preventative work is going to be 100% covered. Anything else going down the line, basic services are 80%, major service 50%, orthodontia 50%. The only thing to take note of is that in the PDP Plus, you will have an annual deductible for both B and C services, which is your basic and your major services. If you are doing individually, if you are doing a family plan, it'll be $150 and $50 for individually. You also have an annual maximum. Your annual maximum that does not include orthodontia will be $5,000 a person, whether you go in network or out of network. Same thing with orthodontia, you will have an annual maximum of $1,000. The good thing about our orthodontia is that we do cover adults, spouses, and of course your children. So it's a great benefit to have. Next slide, please.
Flowers with us because
In reference to our PDB plan, it is extremely easy to find your provider. All you have to do is go on to metlife.com. That's our step 1. Step 2, you would just click find a dentist. Step 3, just make sure that you select the PDP Plus. Once you select that, you can just enter your zip code and it will pop up with the multiple amounts of dentists in your area that you can be seen through the PDP Plus plan. Next slide.
they have all been completely.
So our next slide that I would, program that I'd like to introduce is our DHMO, which is like an HMO, just like your medical in a sense, right? Significantly lower costs. You'll usually know exactly how much your costs are. With this plan, there are no deductibles, no annual maximums, and of course, no claim forms, just like the other PDP Plus. With the DHMO managed plan, your benefits, however, are only available through the participating dentist. So at the time of enrollment, you are going to be able to choose your dentist. However, please note that even though you as the employee have a specific dentist that you always go to and he's in the plan, your spouse or your children might use a different dentist, and that's okay. You can choose those for them as well. Just always remember that. We have over 400 participating dentists, so I'm sure you will be able to find one that's right for you. Next slide. So along with the HMO, we have a copay. So each copay will be a percentage of what the negotiated fee. So we have a negotiated fee with a dentist, and then you as the participant would pay the percentage less that negotiated fee. It is for preventative services, certain fillings, crowns, orthodontics, root canals, extractions, and of course, the biggest benefit you'll have with this is that you will have 4 yearly cleanings, up to 4 yearly cleanings. That's amazing. That's great because you should really get, in general, your teeth clean every 6 months. But hey, go for it if it's 4. Always have good, healthy, clean teeth. So that's how the DHMO managed care works with MetLife. Go ahead and go to the next one. So just to wrap everything up, you do have 2 plans. You have the PDP Plus and you have the managed care. If you have any questions about either one of them, you can go to www.metlife.com, of course, and navigate yourself through that. Or you can call our customer care line anywhere from Monday through Friday, 8 a.m. to 8 p.m. But just make sure that you realize it's Eastern Standard Time. And that number is 1-800-GET-MET8. or you can even contact your own benefits administrator there with your employer. And again, just remember this is recorded, so it's not something that you have to memorize, and all these numbers and all of the managed care providers and things, they're all being sent to you as well, so that you can look over and make the right choice. So thank you all again for having MetLife. If you have any questions, again, I will also be here. If there's anything, just put it in the chat and I'll see if I can help answer them. Thank you.
All right. Thank you very much, Carol. So next
Sure.
up is Sun Life, and we have Jackie Washman from Sun Life. So Jackie, are you ready to go?
Yes, I think I am. Can everybody hear me okay? There we go. All right, so I want to go through this pretty quickly. If you have any questions, please just let me know. But I do want to leave enough time for Trustmark and Legal Shield as well on this presentation. My name is Jackie. I am a licensed agent with Sun Life. Our purpose is to better serve our members, help them achieve lifetime financial security, and live healthier lives. Next slide, please. So we'll begin with the life insurance, which helps protect your loved ones from a loss by providing support for financial expenses or to leave a legacy behind as well. Next slide, please. By leaving a financial blanket, you'll ensure your family will be able to pay for household expenses or hire someone to help take care of the kids. Maybe your income has been financially supportive for someone and you want to ensure that support continues. Maybe you don't want to leave loved ones behind with debt or funeral costs as well. And then, of course, that legacy. I have mine also going toward to St. Jude, so you can also provide charity for facilities as well. Now, the basic life is offered at no cost to you and is provided by your employer. The benefit amount is $50,000, and this does also include accidental death and dismemberment, which we'll cover in just a moment. Next slide, please. You can increase your life insurance by life insurance coverage by choosing the voluntary life for not only yourself, but also for your family. And the child rates are one rate for all the dependent children listed in the household. For you, you can elect a $10,000 up to $500,000 in increments of $10,000. For your spouse, you can elect $5,000 up to $250,000 in increments of $5,000, not to exceed more than 50% of what you choose for yourself. And for children, you can elect a $10,000 coverage, but remember, it's one rate for all the dependent children in the household. So they'll each one have that $10,000 coverage. If you happen to require, or it's required you to fill out the EOI evidence of insurability form, no worries there. We can help you with it as well. It's a simple questionnaire asking things like height, weight, are you under the care of a doctor? It's very easy to fill out. Once again, we help you with that. And don't forget to update your beneficiaries at least once a year. Now, additional features of the life insurance coverage with Sun Life also are as follows. You have an accelerated death benefit. That means you will be able to pull a portion of your life insurance coverage if you become terminally ill. This is portable, so there is comfortability when you retire or if you leave employers and go to another employer. This also has waiver of premium, which ensures your life protection doesn't lapse while you are disabled and out of work. And then the accidental death and dismemberment benefit, that coverage will double whatever coverage amount you have if you pass away in an accident. And the living benefit is the dismemberment. So if you ever lost a member of your body during an accident, this is going to give you a portion of that amount so that it can help you start over again. And then we'll go to the short-term disability. I know there's difference between the non-California and the California, or if you're in Oregon or Massachusetts. Don't worry about it. It could be a little confusing when you try to outline it all. Just know that your benefit coordinators are going to help you coordinate those benefits, but they pretty much end up being around the same amount. And so just know that there's a different processes maybe for those states, but still your short-term disability is provided by your employer, and they're going to coordinate those benefits so that the amounts are going to be around the same. Short-term disability helps put you back on track when you are off of work. Of course, you're not going to be receiving that paycheck anymore. And this is for eligible disabilities. It helps you pay everyday expenses by providing a weekly check will also help you concentrate on getting better so you can return to work. The short-term benefits are provided once again at no cost to you, and it's provided by your employer. Approved disabilities resulting from injuries are one of them. Of course, these are injuries that are not work-related, illnesses, maternity leave, or if you're recovering from some surgeries. Next slide, please. Short-term benefits are 60% of your weekly income from $25 up to $1,620. Benefits begin on the 8th day you're off of work due to an injury or illness. Once again, that's not work-related, and will continue until you return to work at your full capacity or you reach 12 weeks of benefit, whichever comes first. The next slide, please. Now, this is long-term disability. This is going to pay you every month, and it could possibly pay for a longer period of time. It helps you continue to provide your family and pay everyday expenses so you can return to work and get better, so you can concentrate on getting better. Long-term covers serious disability, disabling injuries or severe illnesses. Maybe you're recovering from cancer, a heart attack, or stroke, and now you're unable to work for a long period of time. Remember, short-term first, and then the long-term kicks in. Next slide, please. It starts on the 90th day that you're off of work due to a covered illness or injury, and this is going to pay you a 60% of your income, and this is for 90 days when it starts, and it can continue until your normal Social Security retirement age or until you return to work at your full capacity. Now, the long-term disability will cover you for illnesses and injuries that may even be work-related. Remember, this is for a longer period of time. And so, and it will pay up to the normal Social Security retirement age, and that's 60%, and it pays monthly. So that gets a little confusing. One pays weekly, the other will pay monthly. Next slide, please. Long-term benefits, once again, you return at your full capacity. I do want to remind people, because I get questions about that all the time, that is your full capacity. So if you're still unable to work, then you're still going to have some benefit there. All right, and so Sun Life has several tools to submit claims, speak to a rep, or submit that EOI form. So if you're required to do that EOI form, don't worry. Agents like myself are online, and we can help you fill that out if it becomes a little bit complicated. We see it every day, you know, so we understand. So we're there to help support you in any way. You can get online at www.sunlife.com/create an account. By creating that account, you can submit claims there. You can look up different benefits, right? You need a little clarification, and you just want to take a look at it. And I read a lot. And so, you know, if you're a reader, they're going to have all kinds of tools there for you. You can also chat with an agent. You can also call us Monday through Friday, 8 to 8 standard time at 800-247-6875. And remember, this is immediate access to your plans. So if you wanted to see what benefit you signed up for and don't really remember what that coverage was, you can just go onto sunlife.com, create an account, and take a look at what the benefits you have and how those benefits work. And once again, us agents are there to help you if you need us. So if you need a little clarification or need help with that EOI, we can help you as well. All right, Mr. Ross, thank you so much, everyone, for having me here.
All right. Thank you very much, Jackie. All right. Next up is Trustmark, and we now have Kay Carley on the line. Kay, are you there? Ready to-
I am.
All right.
Yes, thank you very much. I am on the line. Thank you. My name is Kate Carley, and I work in the implementation department with Trustmark. And I understand that we're going to go ahead and go through some of the products that Trustmark is offering. Russ, would you like me to go ahead and share my screen? I have a slideshow that I can share.
It should be right here. Excuse me. There we go.
Okay, fantastic. So the two products that Trustmark is offering to you would be that Universal Life with long-term care and our accident plan. And I'll go ahead and briefly cover both of those. So the first plan, you can go ahead to the next slide, please. All right. The first product that we're going to be offering is this Universal Life product that and also includes a long-term care plan. And what we like to just, we have Charlie here, that we have a gentleman that we take him through different stages of his life. And we look at why people want to sign up for Universal Life coverage. And we've heard from a few different policy owners, holders, on why they want a Universal Life and the Universal Life Events plan. And some of the feedback that we've received is that they want to be able to take care of loved ones. They want to lock in an affordable rate. They want to be in control and able to plan for their futures. And our plans are designed to last a lifetime. And the policy holder is able to take these and afford this care throughout their life. Next slide, please. So some of the costs that we find that are very beneficial is the Universal Life will help offset the cost of a funeral or burial. You can take with long-term care. You can apply that if you're looking at the long-term life events. This plan offers the availability to cover your long-term care during a period of time in your life that you have extra expenses. That might be if you're paying for college or different expenses. So we want to go ahead and make sure that that benefit plan is available for you. Okay, so what we're going to talk about here is that if, let's just say for the example, if you sign up for a policy with a $100,000 plan, you are actually given, in this plan, you have a rider that's called a benefit restoration rider. So you have a long-term plan that offers $100,000. The benefit restoration kicks in. So essentially your maximum benefit, and I apologize, this slide is incorrect. It says 100,000. It's actually 200,000 would be the maximum benefit if you take into consideration the long-term care plus that benefit restoration. Go ahead, next slide, please. Okay, so what you're looking at with this is you're looking at the difference between the Universal Life and the Universal Life Events Plan. A Universal Life Events Plan has a death benefit that is reduced to 1/3 after the age of 70 or the anniversary of the policy's 15th year. So for instance, the age that you can sign up for the Universal Life Events policy goes up to age 64. If you take that policy at 64, your death benefit would not begin reducing until 15 years later, which would be 79. So this just gives a good example of what the standard Universal Life policy looks like. And then the Universal Life Events, you can see that death benefit reduces where that long-term care stays fully taxed. One of the riders that are in this plan that is an option is what we call an easy value. And what we like to refer to this as you buy low and you watch it grow. So you would start with a lower premium and a lower benefit amount. And then each year on the anniversary of your policy, the premium would increase by $1 and you would watch that benefit amount grow. So this is given an example of a universal life product that if you started initially at $25,000, after a 10-year period of time, you would be looking at that benefit amount growing to $64,000. So you do see a lot of growth. Now this is without any underwriting that's required. It just automatically kicks in on that anniversary of the policy of the effective date. So this is describing that the two products that we're offering, we have that Universal Life Events. That product is available for employees through the ages of 18 to 64. Once you are 65 and above, that individual would be able to apply for the standard Universal Life policy. Okay, so that's available between 65 to 75. One of the benefits that are included is this accelerated death benefit. And basically it gives a payout for a terminal illness with a life expectancy of 24 months or less. It's a one-time payment up to 75% of the available death benefit. There is a $200 fee that is used, and it does your premium is waived for 24 months during this period of time. Now, there's also additional benefits here, which is the waiver of premium. The waiver of premium is if your doctor states that you are totally disabled prior to the age of 70, the disability, the waiver of premium will kick in. Now, if disability occurs from the age of 60, from the age of 60 on, the premium will be waived for a maximum of 2 years. And please keep in mind that the definition of disability may vary by state. On this plan also is an accidental death benefit. This basically will double your death benefit if you die by a covered accident before the age of 75. Now, there's also the optional rider, which is this children's term rider. This is something that you can opt in for. This covers all children within one policy, and you can either take that out for $5,000 or $10,000 amount. The rate does not change based upon the number of children that you have. Now, your plan is also offering a standard universal life plan for a child or a grandchild. So it's either or, you cannot have both. So it's either taking the child out on the child's term rider or enrolling your child into a standard universal life product. Now, the one thing that we always like to point out is that why Trustmark? The nice thing is here, these are the takeaways. The rate will never increase due to your age. So it's issue age, and the rates will remain the same. Your payments are deducted out of, excuse me, excuse me for a second. Your payments are deducted out of your paycheck. So it's an automatic deduction. So there's no bills for you to remember. And you can keep your coverage at the same price and the benefits, even if, so they're portable. So if you retire, you change employment, what have you, this policy is your policy. You may take it with you and keep the same coverage. You go on direct bill directly with Trustmark. Next slide. Now we're going to move into the accident plan. The thing that I want to mention with the accident is that, you know, accidents happen, and, you know, you're all familiar with an accident plan. I'm sure it's a safety net for you. So that is certainly an option that we have. It is to cover, you know, it could pay for any unexpected medical expenses that you have. It can manage any expenses from your day-to-day life during your recovery. So it's certainly something to consider for yourself or for your plan, or for your family, I'm sorry. So the benefits that are covered with the accident plan, you can see that we have the funds are a cash payout that are directly to you, and you can apply them to cover any of the covered expenses here listed: hospital admissions, ambulance, physical therapy, any prosthetics or artificial limbs, or follow-up treatments. The covered injuries are fractures, dislocations, burns, concussions, and lacerations. And these are just an example. There's an extensive list of things that are covered. The big selling point for this accident plan is that it's a 24-hour coverage, which basically means that you're covered whether you're at work or not at work. It is a plan that is there to assist you. Now, with this plan is a $50 wellness benefit. So this plan basically, it encourages you to have your health screening and to take some preventative measures. And these are some examples of the routine health screenings that are covered with this plan. It's easy. You know, most of us go in and we have these things done on an annual basis. You submit it and you get this $50 wellness benefit. Now, the nice thing is it's a tiered plan. It's available for employee spouse, employee family. You can include grandchildren, children. So dependent grandchildren, I should point out, needs to be a dependent that's you file on your taxes. And it's tiered, so there's no underwriting associated with this, and it's available to every family member. And again, with the benefits I'm going to mention again, it's pretty much the same with the life. It's a portable plan. Your payments are deducted directly from your paycheck. The rates will never increase due to your age or your health history. You know, so it basically what you sign up for, it's an issue age premium, and it stays the same for the life of the policy.
All
Thank
right.
you very much. And one thing I do like to mention in all trainings is that Trustmark Voluntary Benefits does have a voluntary benefit portal. It has 24-hour access for employees to log into to view their policies, make any updates to beneficiary information or demographic information if you've moved, what have you. It just requires a personal mobile phone and a personal email, and then you have access to that site.
All right. All right. Thank you very much. Okay.
Thank you.
So, hey, Nancy, we're only 1 minute behind. So we're lucky. Last year, I know we were way behind. So Nancy, you're there, I hope.
Yes, I'm here.
All right. So Nancy, go ahead and take it away for Legal Shield.
Thank you so much, Ross. I can't believe that I've been your service representative for almost 20 years now, and I'm very pleased to be supporting you. And I just want to mention that, please, all of you that are already members, or if you have questions, to please reach out to me. Here's all my information. Although as soon as I finish this, I'm grabbing a plane in LAX to go to Greece for 3.5 weeks. So give me a couple days to settle in when I get internet and phone. But so next slide. So what are we? We've been here now almost 20 years. And oh, that's a different slide than I had prepared. Is that the only slide that there is, or is there a whole slide show? Okay, we'll go back. And we'll take care of it. I'll just talk from your slides. So we have two benefits. We have the legal access for the legal service plan and the identity theft shield. Those are our two plans. They both have an app. And I wanted to let you know that these prices that you see here have been rate stable for all these 20 years almost that I've been with you. They are going to go up next year, but they're still $10 to $20, depending on what you get, less than retail prices. So I hope many of you will take advantage of this. We have a member perks program, which will actually pay for your membership. And also, when you look at the prices here, this is per pay period. They're just, I'm not sure these are updated, but anyway, I have a web portal that I can give you that will give all of this that I'm sharing with you up to date. I don't know, these might have been older slides, but these prices, when you combine the two together, the numbers don't add up. That's because you get a discount. If you're a family, you get a discount for bundling the legal and the ID shield for $14.26. And then if you're an individual, it's the same price, but you get an upgrade to our more robust 3-bureau plan. So I'm going to talk about what's covered onto the next slide. Okay, so this is about the basic life issues, giving you peace of mind. And I wanted to mention, we can help you with any area of law in any state that you're in. You will get a 4-hour callback, or there's something new now on your app. You can actually schedule an appointment, which is a really neat thing, because now you don't have to just wait for the attorneys to call you back within 4 hours, which already is great. So you make an appointment from your app. So what do we have? We have personal legal advice. That means unlimited. So you can ask any question in any area of law in any state. Even if you currently have a pre-existing issue, you can still get advice and consultation. They will write a letter on your behalf, and it's an unlimited amount of issues. You have a problem, you can have a letter written. So by goodness, I've saved over $70,000 over the years, 25 years I've been a member. And just some simple ideas of everyday life. AT&T overcharged me and $300. And Legal Shield was able to write a letter, and I got a $300 credit. A contractor that came to the house that didn't do what he was supposed to do, and we got that fixed up. My daughter came home from college, and she had a gym membership, and Then she canceled when she went back to college, but they kept charging, these basic kinds of things. The cleaners ruined the shirt. They finally fixed that for me. Airline problems, or even some big things. We say from the trivial to the traumatic. I actually saved $60,000 on a real estate issue because we're talking to top law firms. I know it costs so little, we don't realize the value of what we had. And again, I'm always available. I'll probably be here another 20 years to help you. There's contracts and documents reviewed. So before you sign something up to 15 pages, you can have it reviewed. There's IRS assistance. They will actually go to court for you for your personal audit and represent you. Same thing with civil trial defense. They will actually go to court. This is lawyers' trial time. You get in the bank that increases every year. So those of you that have been members for a while, you might have the maximum 300 hours, and you'll just have that as long as you're a member. And then there's civil trial defense. Well, I mentioned that. Then there's document upload. You can upload your documents right from your app right now, and they will review them. And in 3 days, they will get back to you. Okay, next slide. It's submitting a traffic ticket. You can do that again on your app. In California, it has to be defensible, but my daughter got her first traffic ticket in college in Colorado. And as a mom, I was so thrilled that I had an attorney to represent her. And then, we've only used it. I've only used anything else that's not covered is still covered at a 25% discount. And I've only used that 3 times in my 25 years, but she'll have emergency access 24/7 if you're being arrested, feel your rights are being threatened, or you have an accident. Okay, next slide. As we wind down with my quick overview. So that's why I'm going to give you a link that you can go to a brand new web portal that will tell you more details. 8 out of 10 Americans don't have a will, and we give you the will, power of attorney, and health directive for free, a trust at a 25% discount. Next slide. And as I mentioned, I've only used that 3 times, but this means that anything you could possibly want, you can get help and advice, consultation, contract review. But sometimes at some point, it might go to a 25% discount if it's pre-existing, not for advice, but pre-existing lawsuit or something like that, a bankruptcy, contested adoption or divorce, or DUI. Next. You're covered, your spouse or your domestic partner. You don't have to be legally married. All your kids up to 21 if they're living at home, or full-time college up to 23. And any dependent kids, if you're a guardian for them up to age 18, or if you have any physically or mentally disabled children living at home up to any age. This is what we are really proud of, helping so many families. Next. Okay, our second service is the identity theft. What sets us apart is we're different from all the other programs out there. First off, it's not just the monitoring, but we monitor everything that matters. And because you're getting this in a group cost, even if you have a pre-existing identity theft issue, you will get our restoration covered at no cost, even if it's pre-existing, with a $1 million insurance. So next slide. So cybercrime is up like 400% since COVID. And breaches are up. I'm sure you notice every week a new breach, like we just got the HCA healthcare breach. And there's one every month, there's some big new breach. But here's what sets us apart from all the other programs out there. One, we cost way less, and your group rate is ridiculously less. But we have the comprehensive restoration with a private licensed investigator that's going to do all the work to put your life back together. In all the areas, not just credit. That's only about 17%, but it's all of the areas. Next slide. So this ID Shield has 2 separate plans. The legal plan, there's one plan if you're an individual or a family, but the ID Shield has a family plan or an individual plan. That's what the difference in price is in the individual and family chart. And it'll include your kids up to 26, if up to 10 kids. and your spouse. Okay, next slide. All right, so how do you enroll? Here is the information that you can get. You're going to need a password. I'm not sure what the password is. They'll have to be emailed out to you so you can get into this new web portal. Benefits. Oh, actually, it's shieldbenefits.com. Please add a shield on top of that. Shieldbenefits.com/LifeCare Assurance. Shieldbenefits.com/LifeCare Assurance. And that will get you to an amazing web portal that will allow you to see everything I said and really spell out the costs. They may even allow you to enroll online, but please just reach out to me. There's all my information. I'm always available, even in Greece. I'll have my phone, my email. I'm going to visit family. We'll be at a place with internet. So just reach out. I look forward to helping empower more of you and being there for those of you that are members. Please download the app and take advantage of the member perks. And thank you again for having me here to share with you Legal Shield.
Great. Thank you very much, Nancy. So, all right. Well, here we are at the end. We're getting ready to wrap up. So the last thing that we're going to be going over are some of the additional benefits. One of them is the nationwide pet insurance. And this benefit is for all employees. And you can sign up by doing this on your intranet website through benefits. This is a program that provides obviously insurance for your pets. And you can see here, you can choose different levels. You can choose a 50% reimbursement. The premium on that is anywhere from $20 to $35 per month, or a 70% reimbursement. And this is $27 to $47 per month. And the reason, obviously, for those who have pets, like I've had pets, and you know that how important it is to have this type of insurance, because if your pet is involved in an accident or has an illness, and I think for those who have had pets and have gone to the vet, it can be very expensive. So this is basically an insurance program to help avoid those expensive bills from your veterinarian. Next item on here, this is your flexible spending account. This is basically a program set up to where you can set aside money on a pre-tax basis. And this will allow you to set aside up to $3,050 into an account. And basically within this account, you'll be able to, again, that money goes into the account on a pre-tax basis, and then you can draw those funds to pay for any unreimbursed medical, dental, or vision expense. It also includes, for those who have children, dependent daycare account, and you can put in up to $2,500 for a single person, or $5,000 if you're filing jointly. We also want to remind you that you have these available to you. We have flyers that I believe that we've given out. I think you've all seen the ads on TV for GoodRx and Single Care. I personally have used this a number of times. And what this is, now, if you're getting generic drugs, this probably isn't going to do you any good. But if you're trying to get a brand drug that is somewhere in the range of, $50 to $100, go online to GoodRx or Single Care and just type in the name of the drug. And there's a good chance that you'll be able to get that same drug for a cheaper price. This is not insurance. Essentially, what you do is when you're at the pharmacy, you want to make sure you have the app on your smartphone. You plug it in, and let's say, for example, you're at the pharmacy and the drug, they're telling you the drug is $50 through your insurance carrier. You plug this in, and let's say it comes back and says, no, it's $30 through GoodRx or Single Care. You just show this to your pharmacist, and you'll get that drug for the cheaper price. Okay. I'm sorry. Okay. I'm not sure what this slide is. I'm sorry. Okay. So action items. So these are your action items. If you decide to enroll in a medical, dental, vision, or life insurance plan, you want to make sure you go onto your intranet. You want to research your providers. Now, as you know, we're switching from Anthem Blue Cross to Cigna. Now, the good news is the Cigna HMO, the doctors in the Cigna HMO, you'll probably find almost all the doctors that were in Anthem in the Cigna HMO, so you shouldn't really have any problem. Same thing with the PPO. Just about all your doctors that you had in Anthem Blue Cross, you should be able to find those in the Cigna network. If you're not considering coverage, please make sure you waive coverage for yourself and or your spouse or dependents. And you need to complete and submit your online enrollment by Thursday, August 24th of this year. So that's 2 weeks. With that, I think we're good. If you have any questions, you can reach out to HR or Libby Walker. And again, keep an eye out for the flyer that's going to be advertising Airbo. That's the kind of the online portal that's going to go through all these benefits, and you can just select individual tiles which have each of the benefits for each of all your benefits that you have available. With that, we are good. And that is it. That's a wrap. And thank you very much. Iris, do you have anything you wanted to add?
No, not really. Yeah, so open enrollment, the links will be ready today for everybody to enroll. If you just click on connect, employee self-service benefits, you will see the links that are for you up there on the right-hand corner for you to make your benefit enrollment decisions. If you have questions, send us an email, call. We're here to answer your questions. That
All
was
right.
it from here.
Thank you very much.
Thank you, everyone. Have a good day.
Thank you.